I'm William Haseltine. I'm the chairman and president of Access Health International. We are a global thought leader in health systems transformation and a partner to government and the private sector in executing that transformation. I've seen enormous changes at some levels and very few changes at others. At the high end, there are now available to, I would say, half of the Indian population, government-sponsored insurance programs which make possible catastrophic care, hospital care. That's an amazing transformation. We've seen the growth of an emergency response system, which means it's possible for people in remote villages and even tribal areas to receive emergency care promptly at a very high level. Some of these systems cover hundreds of millions of people and provide very valuable services. The difference between response times, for example, might be 20 minutes or 20 hours. Before it was 20 hours, and now it's very often 20 minutes. That's a major change. However, if you actually look at how healthcare is delivered in villages and in peri-urban areas and what's available, there's not been the same kind of change. And I think it's time to address those issues. So at one end, there's fantastic changes in the ability of people to acquire high-quality health care. On the other hand, in areas where it's needed on a more daily basis, community care, village care, peri-urban care, there's a lot of progress left to be made. Well, I would say it's fair to say that there's isolated pockets of world-class health care in India, available to maybe 5 or 10% of the population. The vast majority of patients don't receive that care. I have to say that's not unique to India. It's true in China, another substantially large country. It's true in my own country, that medical care is unevenly distributed. What we would like to see at Access Health is we want to work with those people here in India and in other countries that are interested in providing more equity in healthcare, that provide high-quality health care to most people. And that's what we see as the most important transformation. That requires some very serious thinking about how to do that. And fortunately, I believe the time is right to do that because we have the tools in hand to make healthcare more equitable across very broad sectors of the population. One of the things that I personally do as part of Access Health is I look at best examples in the world, from around the world, and I'll show you the book in a minute, but look at best examples around the world of healthcare systems. I wrote a book, for example, on the Singapore healthcare system. Why? It delivers the highest quality in the world at the lowest price. 1/4 of what we in the United States pay. That means it can be done. We don't have to pay $3 trillion. Maybe we only have to pay $1 trillion to get healthcare. And we don't get the quality of healthcare that Singapore gets. So how did they do it? It's doable. Can we do it? Should others follow? On the other hand, I wrote a book on the Indian emergency response system. Why? Because it is an amazing system that provides high-quality emergency care to those at the bottom 2/3 of the pyramid. I think it's probably better to be indigent in India and call 108 than it is to be rich in Delhi and have your neighbor drive you to the hospital. Okay? And most people in Delhi don't even know about the 108 system. It's an amazing thing to see. But I would like to see other countries, including my own country, the United States, implement a system like that. It will save many lives and be cost effective. And now is the example that I've just written a book on called World Class, a study of an American institution, an academic medical institution that had seen much better days and fallen into complacency and slipped down by every measure. And it was losing so much money as a medical institution, it was about to bankrupt itself and its parent university, New York University. Over the last 11 years, it's turned around. It's become the #1 academic medical center in quality and safety. It is generating very substantial surpluses, which it can reinvest. It has moved from to number 40 in medical school rankings to number 3 in our country. And it's been judged recently to be one of the best institution in New York State for biomedical research. It's pulled itself up by its bootstraps. That's an amazing story of transformation. And I think it's got lessons in areas that are critical to healthcare. How you develop patient-centered care that's excellent, that's both safe, effective, and patient-friendly. That's important. How you develop medical education, so it transforms the experience of medical education and makes it affordable in the American context. And how you manage research, something that nobody has figured out very well, but they seem to have done it. And I think it's applicable to India because many of the tools they use are tools that are used in businesses. I was an advisor to Reliance at a very high level. They're chairman of the board, and I know what India is capable of. It's capable of performance, world-class performance, at the very top. You look at Geo, you look at Jamnagar and what they've done there, you look at EMRI and the emergency system here, you look at the Aravind or LV Prasad eye care, you look at what Dr. Trehan and Dr. Krishna Reddy here are doing in heart surgeries and heart medicine. It's the best in the world. You can't get better, but it's not uniform. A very deep study of the transformation of this particular healthcare system. And there are some fundamental lessons that I think every medical center can focus on. The first is that modern technology, I mean communications technology and medical technologies, the advent of radiology, of laparoscopic surgeries, a whole series of things make it possible to take care of most treatments, even major surgical interventions, outside of the hospital. Moving to outpatient care, day care, community care. That's the first lesson. That's what this hospital did. In 10 years, they went from 40 to 400 outpatients. 75% of their surgeries are done outpatient. More convenient, safer, cost-effective. It's a really important lesson, and I think applicable here is moving healthcare into community centers and into villages and into peri-urban situations. Its second lesson is bound together with a comprehensive, real-time, transparent information system that allows you to know what's happening, measure what's happening, and hold people accountable. And it allows the creation of something called value-based medicine. Value equals patient outcome, safety, patient satisfaction, divided by cost. That itself is a component of fixed and variable cost. If you measure all that, you can see what's actually happening in real time in your system and hold the people accountable and it also should be transparent, vertically and horizontally transparent. So one doctor knows what another one is doing. Same thing with education. You infuse education with the highest technologies. So you can measure competency. You both train and measure competency all the way through the training process and post-training. And then for research, you also hold your researchers accountable for their performance. And you make that transparent, both to their bosses and to each other. So these are, I think, simple but fundamental lessons that can help any place, whether it's a highly developed country, one developing, or even one just beginning on that road. I think it's applicable to all healthcare systems, not just the Indian healthcare system. In particular, one of the biggest issues that we perceive here is that although there's very high quality concentrated in some urban hospitals, that isn't distributed throughout the healthcare system. There needs to be healthcare transformation. It isn't the Indian government is thinking about it. It is thinking about it right now and looking for models. The money is there, the will is there, and that's where we at Access Health believe we can make a contribution. Bring examples of the best in the world for consideration. It isn't they're going to be directly applicable, but they can be adapted to this context. What is India famous for? Information technology. What is driving this transformation? Information technology. That should be incorporated. I would say, for example, there should be a transparent, transportable information system like Aadhaar system or your payment systems. The technology is here. Why not apply it to medicine? So this tells you exactly what to do. How you do it, I think, is a matter for adaptation with the institutions here in India.